I obviously welcome the opportunity to give my thoughts on the health service plan. But I have to be honest, Minister, I mean, we're now having a two-day debate on the service plan, and we're making statements. There's four of us in the chamber, and to be honest, I don't think that is the proper use of our time. I mean, it is an important issue. It should be debated in committee. We should have HSE officials in. We should have the Minister. We should be able to pose questions, get answers. And if we're going to debate the plan, then let's debate the plan with people who have the answers, with the people who are making the decisions before us, so we can have a proper debate, rather than coming in here and making 5 and 10-minute statements. Four of us. It's a nonsense, to be honest. It's not like we don't have enough legislation to be getting through in the chamber. We had the Legal Services Bill just before this. We spent 50 minutes on it. 50 minutes. A very important piece of legislation which we're told by the government has to be passed by a certain date because the Troika have put down deadlines. And we spent 50 minutes on it. And we're going to spend another 3 hours today speaking to ourselves in here, an empty chamber, on statements. Not getting any interaction with ministers or with officials on the contents of the plan. I just don't think that's what people put us in here for. I listened to some of the debate yesterday, and I listened to my own constituency colleague, Deputy Darragh Murphy, during his contribution. And I heard it again from the previous speaker, how in their opinion it's possible to have the level of savings that the Minister did in his budget and not impact on frontline services. And I listened to Deputy Murphy yesterday, and he spoke about the attempts that the Minister is making to try and address the problems within the health service. Now, I don't doubt the Minister's sincerity when he talks about reform, and when he talks about, it is his intention to reduce waiting lists, to get a more cost-effective service, to get a one-tier system which is responsive. I don't doubt his sincerity in that. I don't doubt any of the government TDs and backbenchers when they talk about health reform. What I do doubt is his ability to achieve that vision. And the reason I doubt that is because of the policies he's implementing. And I just don't think that the policies that are contained within this service plan are the wider policies in healthcare that this government is proposing are going to address the issues. I mean, I listened to Deputy Murphy yesterday saying it was a target of this government that nobody should be waiting longer than 9 hours on a trolley. I mean, who are we kidding? A target of 9 hours. The target should be 0. I mean, and he stood up and he said it as if, if we did manage to get to a situation where nobody was on a trolley for longer than 9 hours, like it was some sort of achievement. And it's that type of attitude which I think really depresses people outside this chamber when they're listening to debates like this. I mean, I know we're all entrenched in our own political views, Minister, but I mean, healthcare, education, we all have a passion for them. We all believe in what we say. We all believe we have the right policies. And, I have no problem with people criticising our policies. I have no problem criticising the government policies. But I mean, this defensive type of attitude in that I'm right and everyone else is wrong, it doesn't help the debate. We all have good ideas. And maybe if we all start working together, we can start moving forward. But, retreating into the trenches and criticising every single alternative which is put forward by the opposition doesn't help. And I've listened to government TDs yesterday and again today criticising opposition alternatives. We don't have all the answers, and you don't have all the answers. So let's stop this kind of political posturing when it comes to such important issues such as health and education and frontline services. Let's get down to the brass tacks. Let's do what people elected us to do, and that's reform our political system, get this country back on its feet, create jobs, and stop criticising people for the sake of criticising people. Now, I had the unfortunate, I suppose, situation of ending up in an A&E last week with my son. And when we went in, staff were stretched. The waiting rooms were full. 4-hour minimum wait to see a doctor, we were told. After 3 hours, somebody came out. There was a trauma coming in. Another 7 hours. A minimum waiting time of 11 hours in the CUH in Cork last week. It's just not acceptable. And not only is it not acceptable, I just don't see the policies which are coming forward that can help address that. I mean, we're talking about the reduction in the budgets, and the Minister has said, and previous deputies have said, we think we can achieve that without impacting on frontline services. It simply cannot be done. Even in the HSC plan, it says it, and I have it here somewhere. It says that some reductions in services will be unavoidable even with such efficiencies. These will arise in day service, residential and respite services. I mean, even the plan itself states that it is not possible to have that many cuts to healthcare budget without impacting on frontline services. And it's how we prioritise how we spend our money. For instance, we have a situation at the minute with the medical card, and the whole situation, it's a fiasco. I only got an email this morning after making representations on behalf of somebody who had a medical card. It was up for renewal. He put in all the paperwork to get it renewed, and for whatever reason, the paperwork wasn't done in time, and it was cut off. His medical card was cut off. Now, this is a guy who needs a medical card. He's on medication every day. He's gone a number of days now without medication because he cannot afford to buy it. I got an email back this morning from the unit, and they said that they now have received all the additional paperwork and that they will revert back to us in a couple of weeks. A couple of weeks? This is a guy who doesn't have a medical card, who cannot afford his medication, and he's being told wait another couple of weeks. Now, I've listened to the radio the same as every other deputy in here, and we're told that minimum or maximum 15 days and you will have an answer. It just is not happening. And there's no point in government TDs coming out and saying the system is being reformed when we have the reality on the ground tells us different. Home help hours in this service plan. It states HSC South are going to lose 170,000 home help hours under this plan. And that is at a time when, according to the plan, the estimates on the number of people who want to use or who will need home help hours this year is increasing over last year. So we will have a greater demand and 170,000 hours less. And yet, the Minister and government TD say this will not impact on frontline services. It's just not credible to suggest that frontline services will not be hit when we have more people looking for services and we have a reduction in services. It's just not a credible argument. And I don't even know how anyone could stand up here and try and justify it. But there are alternatives. And as I said at the beginning, it's about priorities. And for whatever reason, this government prioritised bondholders over ordinary citizens.
Just 1 minute remaining.
Now,
Deputy.
I know people on that side of the House will say they had no choice. They had to pay unguaranteed bondholders. And if that is the case, then show me the evidence. Because I have yet to see one piece of literature or one piece of documentation from this government which states they had no choice but to pay unguaranteed bondholders. If that is the case, as we're being told day after day after day, then show us the evidence. Put this situation to rest once and for all. But see, you can't do that because you don't have the documentation, you don't have any legal advice which states we had to pay these unguaranteed bondholders. It was a political choice that this government took. And the only people who are suffering as a result of the choice that this government took are the very people in our society who are most vulnerable and who are relying on frontline services. They are the people that are suffering. And what happens? We have a Taoiseach who tells people before Christmas, it's not your fault. He goes off to Davos and he tells the world, it is our fault. His reward, you can shake your head all you like, but that is the reality.
Sorry, please. Deputy, your time has expired.
Okay, I'll finish on this. He goes to Europe on Monday and he gets a pat in the head for it. And that's exactly what happens. And it's that type of cynical politics which drives people absolutely crazy. 4 people in this chamber listening to statements on health. And no matter what we say in here, you know, it's not productive. We should have the officials before committees. We should be questioning them.